Eh, what's up, Doc?
Welcome to Lupus Tips. I'm Susie Eelsflight from Andrea's Gift and Lupus South Africa, and today we're going to talk about the eyes. So let's get into it. 5 ways lupus can affect the eyes. Lupus can affect the eyes by attacking the eyelids, tear glands, tear ducts, blood vessels through the eye, and the nerves that run through the eye. They can become affected, and it can cause dry eyes, vision loss, and also eye pain. Number 1, dry eyes. Lupus can affect the eyes by drying out the tear gland, the tear duct, the eyelids, and the eye itself, and that can cause eye pain, eye vision loss, and dry eyes. There's another autoimmune disease that comes with lupus, and it's called Sjogren syndrome, and that autoimmune disease dries out all the membranes in your body. So you'll have dry mouth, dry eyes, dry nose, and so there's also Sjogren's that can cause dry eye disease. Number 2, Discoid lupus erythematosus. That's the skin lupus. Most of us have both, but some have just discoid or just systemic. Discoid lupus is usually known for causing eye rashes around the eye, dry out eyelids, blisters on the eye itself. That's all caused by discoid skin lupus. Number 3 is renal vasculitis. Now, vasculitis is when the blood vessels become inflamed and then blood flow to that organ is restricted. And that's exactly what happens with the eye. So the lupus causes the blood vessels running to the eye to become restricted, and that is renal vasculitis. Number 4 is scleritis. Lupus causes scleritis. The sclera is a round white ball of the eye. Over time, scleritis can cause the sclera to become thin and even perforated. For most people, scleritis is pain, light sensitivity, blurred vision, eye redness, and dark patches on the eye itself. Number 5 is optic neuritis or neuropathy. Lupus affects the eyes, causing optic neuritis, and it can also affect the blood vessels and nerves, which is then cause optic neuropathy. I added number 6, hydroxychloroquine, because I know that's a great worry with some people because you are on plasmaquine, hydroxychloroquine, quinine, and all those brand names, and how it affects the eyes. Initial stages of hydroxychloroquine toxicity is usually asymptomatic. If they do have symptoms, they complain of visual color deficiency, specifically red objects, and missing central vision. You have to check your eyes every 6 months. I know there's doctors that says a year, but it's easier picked up and can cause less damage if you go every 6 months. The damage of hydroxychloroquine toxicity is permanent. Now it comes to treatments. What are the OTC or other treatments that is used for optic eye diseases? Number 1, dry eye disease. There you can get Refresh, natural tears, all the things that is used for dry eyes. What I do is I get a box of Refresh with the little vials inside, and then I use that. Because if you've got a bottle and it's opened, you have to throw it away after 30 days. Discoid lupus erythematosus, that's when you've got the rash or dry patches around the eye. You can use hydrocortisone ointment. There you can buy it over the counter. It's called Stop Itch, or the one after here is Milocort. Retinal vasculitis. Retinal vasculitis is usually treated with oral steroids. All forms of vasculitis is treated with steroids, and that your doctor has to prescribe. Scleritis. Scleritis is usually treated for steroids and anti-inflammatories, and obviously the doctor has to prescribe it. There are over-the-counter anti-inflammatories like Voltaren that you can use. There's also anti-inflammatory eye drops, also Voltaren eye drops that you can get, but you do need a prescription for it. Optic neuritis or retinopathy is usually treated with anti-inflammatory drugs and and steroid injections, but there are over-the-counter medication that we can suggest. Neuropathy actually happens because of if you take blood thinners that affects the nerves to the eye. And what you can do is you can take vitamin D. You can also use lavender oil and soya milk. Those are natural treatments for the eye that can help with optic neuritis or neuropathy. If you have any other suggestion or advice that you use for your eyes and at work, please comment below. If you enjoyed these tips, please click the like button below. Follow us on Instagram and Facebook and subscribe to our YouTube channel. Andrea's Gift, Lupus South Africa, and Susie Eagles Flight. Thank you for listening, and please check out social, Instagram, and TikTok for new tips coming every month. Remember, giving up is not an option. That's all, folks.
That's all, folks.